are in listen-only mode.
Good afternoon, everyone, and thank you for joining this afternoon's webinar. My name's Jim, and as you're probably aware, I'm the Our Place Programme Manager. I'm here today to help facilitate today's CBA webinar. Shortly, I'll be handing you over to Julian Cox from New Economy, who will be talking you through all things CBA over the next hour and a half, 2 hours. As you know, we've been offering CBA support and advice since the start of the Our Place programme, with events held in the spring and in the autumn time. We've also gone through the pain of logic modelling, which resulted in 55 areas of the 118 presently on the programme being recommended to complete the New Economy spreadsheet and the CBA as part of your operational plan. What the logic modelling exercise did enable us to do was to easily identify, or more easily identify, the key theme for each of the areas. And so from this point onwards, our CBA support will be targeted at areas delivering similar themed proposals. I think in the exercise we came up with about 5 or 6 different themes. Hence, sort of today, you're invited to this webinar because the focus is on those areas who have a commonality linked to sort of employability and employment outcomes. And that's the largest category and theme, with about 17 of the 55 areas, and I think 12 of you have registered to dial in today. So hopefully you'll find this session useful and a bit more focused into what you're trying to deliver locally. Hopefully that's given you a feel of why you're dialing in today. Before I'd start, I'd just like to go through some housekeeping with you. I'd like to let you know that the presentation slides you see on screen today will be emailed to you after the event, likely tomorrow, so that you can have a look at them. And that also includes the worked example that Julian will talk through that has a specific focus on employability. Also during this presentation, one at the start and again at the finish, we'll run 2 polls, and this is a chance for you to give presenters some feedback. When we run the polls, you will see a blue box appear on your screen, and all you need to do is select the option that relates to you and click on it with the mouse, and then we can share the results just within a minute or so. It's a very quick process. We'll also be having some question and answer sessions, again one in the first third of the session, and then again one towards the end. Regarding question and answers, if you look at the right hand side of your screen, you'll see there is a control panel. In the bottom half of that panel is an area for you to type questions. We will be pausing to answer some of the questions you're sending to us. Any questions we don't get a chance to answer will be discussed with Julian and colleagues at New Economy, and we will get back to you. Just finally, what we're also proposing to do is, towards the end of the session, after the first hour or so, is actually hand over the mic to each of you in turn, so you can just give a quick summary to Julian about any key challenges or any key questions you have about your involvement with CBA and the process that you've undertaken to date. So each of you will have that opportunity to come on live on the mic and ask Julian, just give him an update on progress and ask any specific questions that you feel would most help you going forward. And I said that'll be towards the end of the session. That's it for now. So all I have to do really is hand you over to Julian for the first part of the presentation. So Julian.
Thanks, Jim. Introduce myself, I'm Julian Cox. I'm Deputy Director of Research at New Economy, and I will have met a few of you at the CBA training sessions we did earlier in the year. Some of you might have been to ones with my colleagues instead, but today I'm going to take you through the following agenda. So initially I'm going to go through a blank model and talk you through general headings of what goes in where, and then the bulk of what I'm going to talk about is a completed CBA for a hypothetical employment support example, show you what's been filled in, and hopefully that will answer some of your questions and sort of explain how a real spreadsheet would look, and hopefully you'll get an idea of how your proposition compares to the one I'm going to go through today, and it'll give you a good starting point on completing the analysis. Then, as Jim said, it's over to you to give us an update from each of our areas and able to ask any sort of specific sort of points for your analysis. And then finally we'll wrap up with some next steps and Q&A. This is my first webinar I've run, so hopefully it's all going to run well, so please bear with me if there's a few technical glitches along the way. So first thing I want to do though is hand back over to Jim very quickly for a quick poll on how much progress you've made on your cost-benefit analysis, and this will give us an idea of where you currently are at. So Jim's just opened that now. So if you can all click on there to give us an idea of where you're up to. Okay, so Jim's just closed the poll now, and you can see the results there. So most of you somewhere in the middle. Some of you have done a lot. That's great. Good to see that no one's put no progress and hasn't started at all. Most of you somewhere in the middle, either a little or a moderate amount of progress. So thanks Jim for hiding that away. So the next thing I'm going to do is to talk you through a blank model. I need to switch over to the model on my screen here. And one thing I've just realized is I've got a complete model but not the blank model, so let me just find that just now. Okay, so I've now pulled up that model, and I'm sure as you've worked out when you've opened the model, the first thing you would always need to do is enable macros to make sure that some of the specific sort of buttons that all work and that make it a lot easier to navigate the spreadsheet. So I'm just going to click that. And what I'm going to do now is just take you through a pretty high level the tabs and just sort of make sure everyone's up to speed on what goes where. But then the bulk of what I'm going to talk about is when I go through the actual example model for employment program that I'm going to talk about in a minute. First off then, let's just quickly go through the tabs. So the first one is just a QA tab saying which version of the model we're working on. So the latest one you should be working on is version 4.1, which came out in the summer. And then along the bottom we've got the other tabs. The blue tabs are where we start to put information into the model. The green tabs are ones for the confidence grade, the optimism bias correction. The orange tabs are the output tabs.
Sorry to interrupt you.
Different metrics.
Right. Sorry to interrupt. We can't yet see your blank template on the screen.
That's strange. It's strange because it says people can see my screen. I wonder if it's because the poll's still open for some reason. What can people see? Can you see anything at all, or Jim, can you see anything, or was it just?
We can see it says our place CBA webinar 1712, presenter Julian Cox.
Right, so it's the Let me just turn my screen off and turn it back on again and see if it comes up. Hang on.
Yeah, we can see your screen now,
Yeah.
Julian.
Okay.
Yeah.
Sorry about that. Okay, so yes, I'll quickly start again. So this is the QA screen where you can see it's version 4.1, and then along the bottom we've got the different tabs. Blue ones for inputs, green ones are the optimism bias, the orange ones are outputs, and then right at the far side are two purple ones which you shouldn't need to touch for these sort of projects. It's just if you're adding in other outcomes, you might want to tweak some of those, but most of you probably won't need to do that, at least in initial cases for your models. If you are adding in other outcomes, please get in touch and we'll make sure that everything works out properly in the model and any extra bits are added in on those purple tabs. Moving across, we've then got a tab for the proposition summary, where your title, your description, which year you're starting the project in, time frame, and some comments. The next one across is the agency list, and this allows you to turn on and off agencies to get the graphs and drop-down lists working properly. Then we've got two tabs for benefits and costs. The benefits one is where the bulk of the information goes in. We've got the outcomes down the left-hand side, and columns along the top in blue are where highlighting where you need to put numbers into the model, and the pink ones are where you put text into the model to explain your numbers. The cost one is slightly more straightforward in that there's less data to feed into that model, but again, you break down your costs into different categories, put in the predicted costs. You can also then put in where you're making either efficiencies or your what's called offset costs, where you're stopping doing something as a result of doing the new interventions. Allows you to then assign which agency is delivering that and paying for it, whether it's capital revenue in kind, put the optimism bias correction in, and then the spread of those costs over the duration of your project. As you can see here, we've got do up to 25 years. Most of your projects, I would anticipate you'll be looking at a much shorter time period than that, and we would normally recommend a 5-year period for most projects. I'll just quickly show you on the proposition summary, if I went to change that analysis time frame to 5 years, assuming macros are enabled, that should now, when I go back to costs, we're going to see those columns for the first 5 years. So again, it hides away all the extraneous data that we don't need. I'll talk very briefly about the cohort impact calculator when we look at the worked example. I won't touch on it now. We then got the optimism bias matrices. So this is where you can grade your data and color code it based on the confidence in it. And then the cost data, again, quality of that data, and grade it green to red and add up to 40% onto the cost to take account of the confidence in the analysis. I'm just going to stop briefly there just to remind you, if you have any sort of questions as we go through, please type them into the question box, and there'll be a couple of points during the webinar where we'll collect those questions and then try and answer them in one go. So moving back onto the spreadsheet, we then got onto the output metrics. These are all blank, but these will all complete when we start to put data in, and I'll show you some of those when we look at the worked example. Okay, so I'm just going to quickly pause there now and see initially, are there any questions on the sheet itself, the approach to CBA, before we start getting into the detail on the worked example. So if you've got any questions, just quickly type that into the question box. If we don't have anything in the next 20 or 30 seconds, I'll move on to talking about the detailed example. Okay, that's great. It seems like you all obviously have seen the model before, and you know what we're trying to do. So what I'll do now is I'll go and talk you through a completed model. Okay. So as I mentioned before, this model is one it's a hypothetical model that we've created just for these webinars, and this one's specifically focused on an employment support project. So in the proposition summary box, we've got our title, and then we've got a description of this program. So this is a program where we're trying to target the long-term unemployed, making sure they are both identified what needs they are and get them signposted and supported for skills, drugs, alcohol, mental health needs. And we've got a small number of agencies who are involved in delivering that project, local authority, Job Centre Plus, a local charity, and for a number of the sort of supporting interventions like drugs and alcohol, the NHS. And a key part of this project which we've created here is that the people being supported by the project will get support from a peer mentor who is a volunteer that's supported by that charity, and they will be doing the bulk of the work to help those individuals enter sustained employment. So we are assuming this is going to start in 2015, and I've assumed a 5-year time frame for the project. See down here we've got some comments and caveats, and actually I just realised that we developed this from another program which was slightly similar but involved offending as well. So actually that comment is not correct. That caveat is not correct. So I'll take that off before we send it around to everybody. So that's the sort of the overall detail of the project. We move on to the agency list. You can see here I've turned some of the agencies off because they aren't relevant to this intervention, so we've not got any criminal justice agencies involved. However, we have got local authority, the NHS, the DWP will be a beneficiary when people get back into work, the local charity is providing support, and the local Job Centre Plus branch. I've not lumped in Job Centre Plus with DWP because I'm trying to break those out into two different categories, because one is going to be delivering the service, and the other part of DWP is going to be the beneficiary of people getting back into work and reducing the benefits bill as a whole. So that turning those yes and no's on and off makes the drop-down lists work. Just to remind anybody who hasn't done this recently, all you do is you put a yes or no by using this little drop-down box, or typing in a yes or a no into that column there. So I'm going to turn that one back off again by typing N there, which automatically knows it's a no, and that will turn that back off. That will mean that all the graphs, we'll look at those in a bit, only include those agencies. You can always come back and change these again and add more in or turn them back on and off. So, but it's useful to have a good stab at a starting point to minimise the number of agencies you are then trying to assign costs or benefits to. One real important thing to make sure you don't do is to overwrite some of the agencies with a different type of agency. So if you had another sort of organisation that was supporting the project, please use these spare rows at the bottom here rather than overtyping the NHS or the police with that agency. The reason for that is sometimes you might find that the benefits are assigned to the wrong agency because some of this is pre-populated data that says that the NHS or the police will receive a certain proportion of the benefits of some of the outcomes we have in the model. Moving on then to the benefits sheet. So here, what we've got, I'm just going to unhide all the rows, so back to what it would be when you started the blank sheet. So again, here I've turned on and off the relevant outcomes, and you can see when you turn them on and off, they go from grey to black if they're turned on, and back to grey again if you turn them back off again. That means that anything that's greyed out doesn't get included in the analysis, and it also means that you can shrink those rows away by clicking on this Hide Unused Rows button here. So you see that the outcomes we've got in this example model are obviously increased employment, which will be common to all of your propositions, I'm assuming. But then we've got some other supporting outcomes like mental health, drug dependency, and alcohol dependency. And the bottom here we've got a couple of the well-being indicators where, in this example, we've got some evidence that we've used for understanding the change in well-being of the cohort we're working with for individual confidence and self-esteem and family positive functioning. Most of the R-place areas probably won't have any data as yet to really put a number on these well-being indicators, but so it's worth identifying where you think you are hoping to increase well-being, and then putting in place relevant monitoring as you deliver the project, whether it's surveys or other tools you can put in place to understand the change in people's well-being as they have been through the project you're working with. So I'm now going to go across the top and talk through the different columns and what goes in each of them, and explain how we've done it for this employment example. So here we've got a mentoring project where our assumptions are we've got 20 mentors who are supporting the clients in the project, and the assumption we've got here is that there's a certain capacity for those mentors. They can work with 7 clients for a 6-month period, so over a 2-year period which we're modelling this project on, we have a total of 560 people who can be mentored through the program. And as you can see, I've assumed that same target population all the way down the sheet. We then need to understand for that target population how many of that population have a need for each of these outcomes. So by definition, this project, they're all out of work, so we're going to need to apportion that 560 across different benefits types. And here we've got 3/4 of them assigned to job seekers allowance, and 140 assigned to ESA on capacity benefits. The other outcomes further down are for mental health, drugs and alcohol, where we have only a percentage of the cohort will have those issues. So here we've assumed that 30% of the cohort have an underlying mental health need, which needs supporting, and 20% of the cohort have either or both a drug or an alcohol dependency need. And then at the bottom for the well-being indicators, we assume the whole cohort has will have the opportunity to improve their well-being, so we include the whole 560 in this case. For this specific example, we then have looked at engagement of the population, and for this one we've assumed 100%. Now this might not be the case for your examples if you are trying to support a much larger number. Maybe they won't all engage with your program. Here we've assumed that we've got a capacity limit on the mentors, so we will find 560 people from somewhere in the community, so we will definitely engage with the whole 560 cohort. We then have a column to then say, well, of those people who do start the program, how many are retained all the way through and to complete the program. In this case, we've taken the example from elsewhere in the country, in this case Birmingham, and we've assumed the same number for our model here. So 70% of those people who start the program do complete the course of the program and achieve case closure. The next two columns are probably the key columns in the model. We've got percentage impact and percentage dead weight. So percentage impact is how likely it is that people who complete the project will achieve the outcome we are aiming to do in this model. So here we've got for employment, again we've taken some evidence from a similar scheme elsewhere that 36% of the cohort will get into employment. We then need to temper that by thinking about what would have happened anyway if our project wasn't in place, if those mentors weren't working with the cohort. And you can see that here we've assumed some dead weight data, what would have happened anywhere from that same study we used of 24%. So what we're saying effectively is we've got an extra 12% of the cohort who are gaining employment compared to what would have happened anyway. There's slightly different numbers we've got for the other outcomes as we'd expected. So for mental health, we've taken data from a troubled families intervention in this case, of typical program, sort of typical intervention for mental health, 25%. And dead weight there we've used expert judgment, which is why you can see we've got a red color coding for our optimism bias. For drug dependency here, we've taken some national studies on drug treatment. This detour study showing that 49% of people who get that sort of intervention resolve their drug dependency issues. And for alcohol dependency, we've based that on local data. This is actually local data from Manchester. We've got about 60% of people in those programs are no longer dependent on alcohol at the end of the program. The well-being information is it's more of a distance travelled measure than a yes or no, so you don't either have well-being or not. But here we've shown through a survey that well-being increased by 56% for this measure and 37% for the positive functioning measure. This is sort of synthesized data, so these aren't actually real data points here, but just to really give an example for the model. You probably wouldn't ever expect quite as high impact as those would suggest. So those are the key inputs in terms of data. As we move across, you then find there are more blue-headed columns that are already filled in for the outcomes. So where we've got employment for different types, we've got the standard numbers we've got in the model which are pre-populated for the fiscal benefit, and then the overall unit public value benefit, which incorporates the economic and social benefits as well as the fiscal benefit. The next column that we would need to fill in, though, which isn't pre-populated, is the optimism bias correction. And here we've taken the worst case for the confidence that we've got in any of the data points back further left. So the top ones there, these red ones here were because the data was quite old in this example. So we've taken the worst case and taken away 40% of the benefits. Different numbers for the different outcomes depending on the data we're feeding in. And then as we move across, the final thing we need to fill in on this sheet is the impact year on year. So we've got 25% in year 1 and rising up to 85% in year 3 and back down to 73% in year 5. And these numbers I've come about by using the cohort impact calculator. So I'm just going to very quickly explain that for this project. So we've assumed for our outcomes here that for a single cohort going through, there'll be a lag of 6 months in the project for them to achieve employment or the other outcomes. So for any cohort starting in 1 year, only 50% of that benefit will be achieved in year 1, will then rise up to 90% in year 2, and then we won't anticipate it being sustained forever, so we're dropping back off over the years 3, 4, and 5. However, this project is a 2-year project, so not everybody is starting in year 1, so we then need to think about those people who start in year 2 and see what the aggregate impact would be. So I've taken that sort of standard profile, and then I've split it across years 1 and 2, so put 50% in year 1, 50% in year 2, and then this little box here just calculates a relative impact for each of those 2 years of cohorts, and then it sums it up at the bottom here. And it's these numbers here that then you would then copy across and put in your benefits tab here. So that's all the data that's filled in on the benefits tab. You'll see there's loads of columns to the right here, which we don't actually need to fill anything in. They're just output data, pulling through from other sheets and producing some of the costs here for different agencies, for different outcomes. All that gets brought forward into the output metrics and the graphs, but it's here if you want to drill into any of the detail of those numbers. So I'm now going to move on to the costs tab. And as I mentioned before, this is actually much more straightforward. We've got here we've got 6 categories I've got here. So the peer mentors, we're assuming some payment and expenses for each of those peer mentors per mentee of £1,000 here. And because in this example we're assuming that's co-commission between 2 agencies, I've broken that into 2 separate lines so that we can assign 60% of it to the job centre and 40% to the local authority. Then made sure we incorporate all the incurred costs by other agencies as a result of the programme. So here we've got 3 referrals onto different services: mental health, drugs and alcohol. For these ones I've used a ready reckoner approach, a unit cost per person going on that programme, and then I've taken some of the numbers in the benefits tab of those people who need mental health support and multiplied them together. So I've just used a little formula there to multiply those together to come up with those numbers. For the drug and alcohol referrals here, for this example, I've actually put in a figure for what we call offset costs. So here we've assumed in this example that people will get referred onto drug and alcohol programs, but 10% of them would have been already on those programs anyway. So because we're only looking at the additional costs of the program, we can sort of net those off against the total costs. So I'll put 10% of the costs in there, and what you'll then see happens is the formulas will then subtract one from the other to reduce the overall cost. So here, in this case, we've got 67,000 taken off that 679,000. We're then adding a bit of altruism bias back on again, so we get to about 702,000. So it would be much higher than that if we hadn't taken away the 10% of the costs that have been delivered anyway. The final row I've got in this model here is around training and support for the mentors. So this is sort of an upfront cost for the project, and here I've just assumed a fairly high-level estimate of the cost of training. For this example, we're assuming that's provided by the charity as without being paid for, but it is an in-kind cost we need to take into account because there is a value of that volunteer time to support the mentors. So I talked about the cohort impact calculator already. I'm going to move across the sheet so that again, these are the sheets I use to understand what confidence we should have in the data, color code it, and then decide what optimism bias to use. And then we've got the output metrics sheets. So on this, I'm going to start with this one, which is a table of all the numbers that are produced by the model. We've got two key boxes here, the financial case and the economic case. Now in this example we've got our costs over the 2 years and then the benefits over the 5 years. They then get adjusted based on the standard Treasury Green Book discount rate of 3.5% a year, which basically reduces any costs or benefits in the future by a proportion to bring them into line with sort of current value of money in the start year of the project. We then, on the right-hand side here, get some net present values, which are basically just adding up those discounted costs together. And you can see in this case, we're spending 1.5 million on the project, and we are saving over the 5-year period 1.3 million. So in this case, for this project, it's actually costing us a bit more than it is we're getting back in benefits, and that's shown by this financial return on investment box here. So this is saying that we shouldn't see this project as a budget saving exercise, because in fact it's costing us more to do it than we're getting back, and we're only getting back 84p in savings for every pound we put in if we just look over those 5 years. However, when we go down to the next box, this is the economic case, and this shows the overall value to society of the project, and this case is much stronger. So we've got that same cost going in, but the total public value created is almost £7 million, and we get a big impact there. So this box here is the key one, this public value return on investment. It's saying for every pound we put in, the overall public value we get is £4.3 back. At the bottom here, we can then got a box where we can use these drop downs to understand different agencies and how much they get in the fiscal return. And the final thing on this output metric sheet we can then use to toggle on and off is think about cashability of our savings. So at the moment these numbers are based on assuming we can cash in all those benefits. We can also look at then short-term and long-term cashability of those benefits, and it will produce a slightly different number. Continuing across the sheet, we've then got some of the graphs that we produce. So we've got the cost pie chart, which shows who's putting in money into the project. So we've got here the mentors supported by local authority and Job Centre Plus. We've got the training by local charity, and we've got the health service providing drugs, mental health, alcohol treatment. We've then got the benefits and how they split down, and you see a lot of the benefits around getting people back into work and saving money to DWP and the Exchequer as a whole. But you also see there's quite a big chunk of savings to the health service in terms of improving people's mental health or drugs and alcohol dependency. And we can bring those all together in the column chart, which shows money going in the blue columns, and then those reactive cost savings over the 5 years, the benefits, and the yellow columns. And this one here suggests that there might be a strong case for the DWP to put more money in than just what the Job Centre Plus is paying to sort of support this project further to make to achieve these benefits of getting people back into work. We could also do a similar one looking at cashability as well, and those are then that concludes all the output metrics. Right to the right-hand side, I mentioned before, these purple sheets are sort of expert user sheets. You'd only need to change these if you are adding in any spare outcomes. If you added a new outcome in here, you would then need to say where those benefits fell to different agencies, splitting between the different groups. And the final one is assumptions on cashability. So this is in the short term and the long term, some initial numbers we've got for how much for each agency is cashable. The big red text here says please only use these as a starting point for discussion locally, because it will almost certainly depend on exactly what the project you're doing is, how cashable some of those benefits are. Okay, so I'm hoping that's given you an idea of what it should look like when the spreadsheet is complete. Jim, have we got any questions that have come through specifically on the technical details of the modelling?
No, there's no specific questions at the moment. If anyone does have a question, then by all means just type it through. I mean, we are going to go to the sort of open mic session very shortly, so obviously that's an opportunity for you to discuss with Julian any specific issues around your CBA locally. So for now, there are no questions, Julian.
Okay, so in that case, go back to the slide deck. It's really over to you guys, so I'm going to hang back to Jim in a minute, and he's going to sort of open your mics up one at a time for you to sort of talk through where you're up to, any specifics for your area you want to discuss, and hopefully we can then provide some answers to those questions now, or if not, we can note those down and come back to you and help you sort of make progress with those issues. So, Jim, do you want to start people off?
Okay, well, I'll start at the top of the list of the attendees. This doesn't always work for everybody because it depends on how you've dialed in, whether you're using a phone or a microphone. But for the majority, it works, he said confidently. So I'll start off at the top, and I'll give the mic to Belinda. No, it's not liking that because I think Belinda is using her telephone. So I'll try David. Hi, David. Can you hear me?
Hi. Yes, I can.
Excellent. Do you want to give us a quick update of how you're getting on with your CBA or the challenges you're facing? Any questions for Julian?
Okay. No specific questions as yet. We've been matched by locality with Pro Bono Economics to help us develop our CBA, and that relationship's going very well. We've had a couple of meetings with them, and I think the issues for us were really conceptual ones, I suppose, understanding what sort of costs needed to be input, how we quantified some of the benefits, talking to the partners, because we're in a partnership where most of the organisations are community and voluntary sector, so there's been a lot of skilling up, a lot of understanding what costs should look like, and we've got over that. We've sort of come up with some quite useful interim figures and fed into the CBA, which, although we've still got some holes in the data, has come up with a positive CBA, or cost neutral on the fiscal analysis and positive on the public value. Although, as I say, we've still got some holes, and we want to plug those in the new year with better quality information. But I think that's the issue for us, is getting the right quality of information going into the model rather than the model itself. It's a job hub model, so we're combining services around employability and job finding onto one site within an area of North London. So it's not so dissimilar to the model that has been worked through here, actually. That's where we are.
Okay, do you have any immediate comments, Julian?
Not really. I suppose one of the major issues is getting the concept across there. So I think when I've been working with areas, that's been an important first step. But I think so you haven't got any specific teething problems you haven't managed to resolve through work with Pro Bono. Is that right, David?
Yeah, that's right. It's been a really important part of the process for us. I mean, what we're keen to do is embed some of that learning within our organisation and within our partners. I guess that's part of the point of the Our Place programme, to be honest. And I think at a fundamental level that will happen, although it's inevitable that some of the top-end detail will not remain within the organisation. But I think it has moved us forward, undoubtedly.
Excellent. Okay, I mean, for those who don't know, Pro Bono are one of our delivery associates, who deal with CBA along with New Economy, but the brief for pro bono is to work more intensely with 4 to 6 community and voluntary organisations to support them with CBA, and pro bono match volunteer economists with local charities, and obviously David's organisation is one of those who are benefiting from pro bono's input. So that's excellent to hear that the relationship is going well, David, and you're finding them useful. Okay, well, thank you. I'll now open the mic to David.
Hello.
Hello, David.
Hi, how are you?
Yeah, good, thank you. How are you?
I'm good, thanks.
Excellent.
I had a couple of questions about the benefits slide. I don't know if it's possible to bring it back up. The benefits, tab.
Yeah, just bear with us a second.
So, in those B1, B2, B3, as a result of our project, we create part-time work opportunities that didn't exist before. But there's no, so I think we had a chat about this on the telephone when I called you a couple of months back. Rather than run a centralised service where people are just paid, from central, we're running it locally, and people are therefore, we're creating ultimately 26 part-time jobs. Now, that, I guess for me, from an economic perspective, all we do is move the money from being paid to Fred to being moved to paid to 26 people locally. But there is a benefit of being local people. They have money in their pockets and they're now going to spend that. So I don't know, we're not moving them off benefits. They're just young people that didn't have part-time work before and have been scratching around for it, and now actually there's 26 part-time work opportunities. So I'm not sure if we are effectively increasing employment because the 6 villages that are going to be operating the scheme traditionally would have they would have had their work centrally managed by 2 people who would have been full-time. We're now going to be offering 26 people an opportunity to earn money doing the work. So there's a benefit of 26 people benefiting, even though you could argue, well, hang on, you're just taking the money from paying 2 people and paying 26 part-time rather than 2 full-time.
Yeah, I suppose you said they're still going to be on benefits, though.
No, none of these people were on benefits to start with. They just didn't. They just couldn't get access to part-time work. Because what we're effectively going to become in our rural area is the largest part-time employer.
Right. Okay.
In fact, that's not quite right. The largest part-time employer in our area is mum and dad, followed by babysitting, followed by us. But we're the first sort of bona fide employer, if you like, in terms of offering an actual part-time job, like a pub or a waitressing role or a supermarket or something like that.
Okay, so I sort of see your question. So you're sort of moving that work from a couple of people full-time to lots of people part-time. So I didn't quite catch the couple of people full-time. Were they local as well, or?
Well, no, because the service used to be run centrally across the county,
right.
And they would have hired a contract to do it. And in our 6 villages, there were 2 guys that were assigned to our area, and they used to just go through and mow it X amount of times a year. Well, now that they no longer do that, and now it's passed to these 26 part-time workers who will do the work.
Yeah, I'm just trying to think through in my head. There's no real change in benefits payments, so a lot of the fiscal benefit in those categories wouldn't be relevant.
So I guess this is where I have a slight issue with the model, because the model just looks at it purely from the government's perspective. It doesn't actually look at it from the 26 part-time employees that are all chuffed to bits that they've now got local part-time work and got money in their pocket they never had before. So it doesn't capture that benefit to them. I guess it does further down in terms of the social benefit around self-esteem and all of that. But actually, to be honest, none of them lack self-esteem before anyway. But they're all chuffed to bits that they can walk out their front door, walk 200 metres down the road and into their part-time work role, and they've got more money in their pocket now than they had before. In fact, some of them had none because parents weren't willing to drive them 10 miles to the local, to Milton Keynes or something like that. So,
okay. So I suppose that you're right. From the CBA model, the benefits are either economic or social, really. And I suppose if you could show there was more money, you could look at it sort of purely locally and talk about the economic benefit locally, and just draw a box around your local community and understand that economic benefit, and then include their wages locally, and then you could try and also capture the social benefit through well-being, even if their self-esteem was all right before. You might be able to show that they've got even better self-esteem now because they've got that part-time employment. You'd have to do that through some sort of survey of them before or after, and that might also be a challenge finding them before you actually take them on as part-time workers. And you might have to therefore just talk about that benefit as a sort of a qualitative benefit that supports the overall program, but you can't capture in the cost-benefit analysis.
So where it's got 1, fiscal benefit of moving people off benefits, 2, improved health outcomes, 3, increased income, that's the one I initially thought, well, that's what it is, it's increased income. But can I say yes to that one, no to the other 2? And then, because actually 3 people that have, because the scheme's been running in the starter village for the last 2 years, and 3 people who turned 18 went off to university as a direct result of doing the part-time work for us, have picked up work roles, part-time work roles again, at their university location, as a direct result in 3 cases now of having done this part-time work locally, because the employers who have been employed them, 2 in Birmingham and 1 in Manchester, have been so impressed that they, in their words, got off their butts and did something like that. You're the type of person I want to employ because you've got the right attitude. So actually, not only have they got local part-time work, but in one case it helped them beat 1,000 other people to a job at Hollister in Birmingham. So they got that job directly as a result of doing this, which of course has boosted their income even more. But I didn't get a sense that I could, the fact, that I could capture that, because it's not really of benefit to the state, but it's clearly of benefit to the person.
Yeah, I think what you do again is you take that cohort you're working with and you would just look at the earnings, and that will be in the economic benefit column. So it might be best just using one of the orange spare rows and putting it in there, and then almost trying to work out an average wage for those individuals in the economic benefit column, and sort of calculating the numbers through to show that extra earnings for the cohort, which wouldn't have happened without your project.
Okay, that's cool. The other one was that our ongoing capital running costs, so in other words, the asset replacement costs are a lot cheaper. We're starting to get that evidence now. So, we obviously have an asset we use to do the work with, which is a lawnmower, basically. Our ongoing, the county has said they can't believe, what our asset renewal provision is. It's thousands and thousands of pounds, much lower. Our maintenance costs annually and our annual. So actually, the overall budget's the same, but it's how we use the budget. For example, the county would only put 60% into the work, and 40% would be for all the overheads and organising the work, including maintenance and asset renewal and insurance and all the rest of it, whereas ours is 85% into the actual work and 15% for the overheads. So I guess the money, the public money, is being used much more for the work. So we could conceivably. So what the county was going to have to do is drop the amount of work they did from 10 cuts a year to 6 cuts a year. We're able to maintain 10 cuts a year for exactly the same budget. So
Yeah.
I don't know. Is there any way we could capture that benefit? Is that a benefit? Is that another economic benefit, or?
Yeah. Okay. I'm just thinking that I suppose on your, because you're spending still spending the same amount, you wouldn't actually be an efficiency as such directly on your cost sheet. If you would say it's actually cost because you're much cheaper, it would cost you less. You could then put in your on your cost sheet an amount in this efficiency column to show the saving that's been made. But in your case, you're still spending the same money, but as you say, you're doing 10 cuts instead of 6. I suppose that comes back to then having another outcome for a grass cut in your spare columns. If you could come up with any way of valuing that, because effectively you're providing a better sort of service to the community of having 10 cuts rather than 6. I'm not quite sure how I would go about monetizing that additional benefit, although people would obviously appreciate a better maintained environment. So again, that might be one way you have to sort of show through sort of words rather than numbers the benefit that supports your program there.
Okay, cool. Improved skills is mentioned, but it's all. It seems to, in the model, it seems to be dependent on NQ level 1 or 2 or 3. Or now, the 3 people that have gone on to university, therefore left the local area, and they've also all got the work because they were more organised. They were better. They were better at engaging with customers, because that's all part of the learning program attached to the scheme. But we haven't gone down to City and Guilds and said, can we have a level 2 certificate for it? So they're definitely improving their skills, but the model indicates it's got to be verifiable. So is there any way we could do skill improvement? And because they have to organise their time, they have to gather customer feedback 10 times a year, and they have to invoice, and the scheduling their time management, and actually all of them, because we evaluated as we go along, have said, the change in, they were a lot more organised after a year of doing the mowing than they were even after 5 years at secondary school. So then they were quite surprised about that. They thought they were highly organised until they came along and did this work and realised actually they weren't really that organised. So I just wonder if there's any way we can capture that improved skills without it having to be an MVQ.
Yeah, the reason we've got the MVQ levels in there is because that's what we can monetize through research. So peers have done a lot of research around the improved earnings and relative tax take of different types of skills. So level 2, level 3 apprenticeships, and etc. So that's the numbers we've got, and that's why those are the ones in the model and also in the cost database. You're right, there will be a benefit to those individuals, but I'm thinking might be more around the likelihood of them actually getting into employment itself. So it's helping them achieve employment rather than necessarily changing their earnings as such. Again, it might be quite hard to quantify that benefit, although you have said that a number of people have gone on.
Well, quite evidence from a sample of 3.
Yeah.
not huge, but
yeah,
that's sort of anecdotal, I guess. I guess we can track that and see whether we continue to get the same sort of feedback, and we get, after a couple of years more, we get 15, 16 people saying, I got this job as a result of doing it, then we've got a bit more evidence. Okay, I had a couple more other questions. One was that, and we talked a little bit about this the other day, but I wonder if there's some way of capturing this as a public value figure, that the overall tax take stays the same. So let's just say that's 100%. But what happens is that over the next 4 years, at the moment, before we started this program, 100% of the tax was collected by the county council, and over the next 2 years, that's going to shift. So the overall tax stays exactly the same, but for this particular service, it's going to be captured at the parish level. Now, the county council's overall budget doesn't change, so therefore, because the parish is now collecting the money they need to do this service, the county council gets more budget, and that's particularly why they've been really keen to do it when I approached them, because it basically gives them more money to spend on adult social care needs. So over the next 2 years, they will have more money available to invest in other services where they have a real budget problem, because we'll be picking up, the parish will start to charge its residents more for that local service, rather than the county just charge more. So I don't know if there's any way we can, I guess I'd have to talk to the county about, well, that budget saving you're physically making, because you're not having to pay it out to deliver the service anymore. I assume you're putting it into adult social care budgets. What benefit is society getting from that?
I can't see an easy way of doing that, to be honest.
No.
But society is also going to end up paying more for it, it sounds like, as well, in case of the...
Well, what if I went to them and said, if you stayed managing the service, about 10 carts, and you had provided all the adult social care, how much would you be able to put the council tax up by in order for, in order to meet both needs? Because it's going to be by a lot more than what we're going to put it up locally to do it. We don't need, we run the service more efficiently. I don't know, perhaps it's just getting too complicated.
I think it might be that one, because I think that there will be costs going up on the parish side and probably staying the same on the county side, because their overall budgets are reducing from other sources, so they will be using that to sort of prop up some of the other things. I don't think realistically they're going to be doing more. They might have to cut less rather than do more as a result. But I think it's probably too complicated for
this. Yeah. Okay. The last one I had was just environmental, but we use very simple lawnmowers which have much lower environmental footprint. All our workforce either walks or bikes to work, and then pushes a mower, versus a great big truck with a trailer and a ride-on mower. Is there anywhere we could capture that? I could probably work out what the carbon footprint is for the old service versus the new one. So there's clearly an environmental value to running the service our way.
Yeah, you could do that. So if you could calculate the carbon footprint in terms of fuel, etc., then there are ways of then using sort of costs of carbon to put a social value on that usage. So they're generally relatively small, but you can calculate them, and that's what I would do. I would say try and work out what the change in carbon footprint is, and then use a standard cost of carbon multiplier to put a value on it.
Okay, cool. Okay, sorry for holding being up so long, but I thought it was useful to run through those. So thanks for that. That's all I had.
Okay. Jim, have you got someone else next on the list there?
Hi, sorry, Julian, I was muted. I was just saying to David, thanks for your contribution, David. Robert, from a colleague from DCLG, pointed out that what you're doing is a really important example of an economic case which needs to be written up well. So even if the model doesn't fit perfectly, we do need to find a way to describe the efficiencies that you've been talking about for the last 10 minutes or so. So that's just to feedback. Okay, well, thank you, David. Next, we'll try Emily. Can you hear us, Emily? Hello.
Yeah, can you hear me?
Yeah, loud and clear. Thank you.
Okay, perfect. Okay, so we're just in the early stages of actually just collecting the information about the costs of our projects. We're developing, well, 3 in total, and we're working with Consultant and Mobilise. So we're planning to try and get some information by the end of the week collected from our partners, because we have different partners who are each leading on the different projects. I suppose I've got a few questions. Just going back to that the spreadsheet and the benefit tab, could you maybe just click back onto it? Okay. Where you've put about your target population, you've put 540 or 560,
yeah.
Sorry. I mean, I'm in a really small district, West Somerset is a very rural district, and I mean, our population in terms of who we're targeting is nowhere near that. I just wondered, how did you, is that the total amount of, is that a percentage of those who are claiming JSA or ESA or low parents income support, or how did you get that figure?
Well, this figure is for an example for quite a large area, so it will be really related to your project, and it might be a lot smaller than that, as you suggest. So there's no reason why you can't use it for a very small project or a very big project. There's no real difference in methodology. I suppose it's just coming up with so the important thing is, yeah, think of the cohort you're working with, how many people are in that cohort, and then of that cohort, how many people have got certain needs. And so you say you've started collecting costs. Have you started to build up from the logic models, key outcomes you're hoping to influence?
Yeah, we have. Sorry, in terms of outcomes in relation to each of the projects?
Yeah.
Yeah, we've done that, yeah. And how many individuals we want to target.
Yeah.
And that's based on a percentage of, well, we've got one which is a mentoring project as well, and that's the funding for that's coming from the department, well, DWP actually as well, but it's only a percentage of our job seekers and our ESA claimants, so it's a very small number. And also as well, it's more of a pilot project. So whereas you were saying about projects last and how long they're going to last for, I mean, in some cases our projects maybe will only last for a year as well.
Yeah. Well, it just actually make it a lot simpler for the analysis. You don't have to worry about that cohort impact calculator. If you just got a year, you just have a sort of year of costs, and then you can consider the benefits for that cohort in that year over a 5-year period. It makes it a bit simpler actually to do the analysis. So, and quite often that's what you have. In Manchester here, we've had numbers of pilots similar to that, where we've got a relatively short period of time to try something new, collect the evidence around it, and then decide at the end of that, do we want to continue that project, or should we try something different if it hasn't worked?
Yeah, which is what our intentions are with all of the projects really. But because obviously with yours, you focus on one project being the mentoring project. But in terms of ours, we've got a mentoring project. We're developing employment hubs, 2 employment hubs in 2 separate areas within West Somerset. And we're also setting up something which is like we call a skills swap brokerage, so where community members can switch skills. So would you have to therefore do, would you therefore do a spreadsheet for each of those separate projects, or would you just clump everybody together? So your target population, would that be everybody who you were trying to target through all 3 of the projects that you were delivering?
I suppose it depends how different the projects are. If they're all working with the same people, then if the cohort is the same people for each of them, then you're probably best combining it into one model. However, if they are designed to target different people, then it might be most sort of transparent to try and think of it as 3 models and trying to sort of understand the cost for each of the different types of services you're delivering, and then think about that cohort for each of the different services and what you can achieve from each of them. Sounds to me like you probably want 3 from what you've said.
Yeah, all three we are trying to target our JSA and ESA customers and our loan parents as well. But obviously we're aware in the district that not everybody who's looking for work will claim benefits, so therefore we're trying to target those as well. But obviously there'll be no, in terms of saving money, there'll be no way you can demonstrate that you've saved money by maybe helping those who aren't registered with the job centre.
That's right. It's a bit like David was saying for their project. There'll be an economic benefit of people actually being economically active, but you won't get the fiscal benefit from those people getting employment.
No, but it's still worth obviously putting it down, even if you can demonstrate that there's an economic benefit.
Definitely. Yep.
Okay, that's it. That was just my two questions really. So yeah, thank you.
Okay.
Okay, so thank you, Emily. We'll now move on to Helen. Helen.
Hi, can you hear me?
Hello.
Can you hear me?
Yeah, loud and clear.
Hi. To be honest, I don't have any questions at this point. It's quite useful hearing what other people have to say. As an update really from where we are with our project, we did meet our consultant before the draft plan went in, which was really useful, and it highlighted for us the parts of the project where we really needed to nail down the cost side of things, and where some of it was a little bit more aspirational and hadn't actually been pinned down to the data. So that's the bit we're still working on.
Okay. Thank you. Do you have any comments, Julian, or? No? Okay. Thank you, Helen.
All right.
Right, I'm now trying to see if I can log in with Sanji. But I've got a feeling she's using a phone, so I don't think that will be possible. If you do have any questions, Sanji, if you want to email them through to me or put them through on the questions. Again, with William Shanks was next on the list, but I don't believe William has is mic'd up. I'll just try. Hi, William. Can you hear me?
Okay.
No.
I can see he's raised a question though, so I'll see if I can try and answer that. So, the question is: I've always struggled to get hold of any data that shows how long people with a certain background, for example, ESA claimants, stay in employment. I need this to work out the drop-off of the benefit over 5 years. Yeah, I think that's a perennial challenge for a lot of us trying to understand sort of sustainability of different programs. Employment's one which is quite tricky because the local job centre doesn't really know either, because they can see who's been on and off benefits, but they don't always know who's actually got work and how long they've got work for. So I think for the models we've developed, we've had to be fairly pragmatic about and conservative about percentages, for especially for things like ESA that we might have assumed only up sort of in over the 5 years, only about 40% would stay in employment through to the 5 years. To be honest, we are still trying to collect data on this, and some of the programs we've got in Greater Manchester will be collecting data on a much longer period with some central DWP help to do that. So I can't really give you a firm guide on that, William, but I think you just need to put in a conservative assumption and explain in the analysis that is the best we can do for the time being, but we do need to collect better data.
And William has another question, Julian. Just about, I could also do with any study that shows a link between employment and reduced GP admissions, hospital admissions, not just in theory, but actual numbers.
Okay, yeah, I can see that question himself now. Yeah, he's so William, the employment benefit in the model does assume that people in employment have lower health needs, and so I click onto the spreadsheet now and take it across to the relevant cell. You can see that in terms of the over £9,800, that's built up of £9,234 of benefits payment saved, but also £566 of health service savings. That's for job seekers allowance. For employment support allowance, it's assumed that it's twice as much as that is saved for the health service for people on ESA. Now, those are not exact numbers, but they are based on DWP guidance on how much savings there are to the health service of people moving into employment from different benefits types. So they're the best we've got, and they are recognised by government as well. So that's what I would use, but it's already incorporated in your employment outcome. So if you can show someone getting into employment off ESA, then the monetisation will automatically assume a health benefit and assign some of those benefits to the health service.
Okay, thank you, Julian. There's a couple of questions from Belinda, who we couldn't make phone contact with. We have 2,000 unemployed in our area, but we'll only target 100 unemployed. Which figure do we put in target population?
Okay, so I think this is similar to, I can't remember if it was Emily or Helen who asked a similar question for their area. Just on this, the spreadsheet we've got here I assumed just the people we were working with in the target population, and then broke them down across different benefits. There is an alternative approach which is just as valid, that you could put your total JSA population in your target population, and then only assume you can engage with a certain percentage of them. So just going back to your question, so if you had 2,000 people as your target population here, and then only 100 you could target because of capacity issues. Effectively what you're saying there is that you are only be able to engage with 5% of the overall cohort, so your figure in the engagement column here will be 5% rather than 100%. You can do it either way around. The maths will work itself out. As long as you're clear what you've assumed and why, you can do it either way around.
Okay, another question from Belinda, and you may have touched on this earlier when we were having the discussion. If you have one spreadsheet for two activities, we have found we lose the benefit of our Wheels to Work project because the employment support worker is reaching out to more people, otherwise risk double counting.
Okay. I don't quite understand the question. I suppose if you've got two activities which are being carried out by the same worker, you'd have the cost for that worker, but I suppose it's then important to ensure you have both cohorts incorporated in your benefits sheet. So if your cohort in your overall target or effective population should be the whole cohort that is being supported by that one worker. Otherwise, the alternative approach would be to just assume a proportion of that worker's time in your costs and have two spreadsheets. I don't know if I've interpreted your question right, Belinda. If not, then please get in touch. We can discuss it offline somewhere.
Okay, and William was just wondering if it was possible to send over the DWP guidance behind the £566 health benefit figure.
I can, yes. Let me the CBA methodology guidance in Section 8 of that talks about how that's broken down, and that refers to another document that BWP wrote a few years ago. I will, William, I'll dig it out and send it directly to you. But if anyone else wants to find it, you should be able to sort of track it back. So if you look at either the cost database and the link in that, or the supplementary guidance to Green Book, the CBA methodology document, in there, it breaks down each of the standard outcomes in the model.
Okay, thank you. I think that's the last question for now. I say if anyone has any further questions after the presentation, then by all means send them through, and we will. I'll link with Julian and colleagues at New Economy, and we'll try and answer them and forward them on to you. So yes, so thank you for
Jim. So
yeah.
I've just spotted there's a question from Sanji about multiplier effects for local economy. I'll just try and answer that one off.
Fire away.
So what she's saying is interested in any advice on how best to incorporate local multipliers for financial gain in the local economy. So I think her question is that if, for example, on the employment benefit, if we are showing, move across to where the monetization is here, that we have got people earning money, and the equivalent here is £14,000 for someone moving into work off job seekers allowance, a typical wage that they would get annually. Whether we can incorporate a local multiplier, which would say that they're earning money, they're then spending money and then helping employ someone else. And normally for the modelling, we don't use that. We just look at the direct economic benefit of that individual to take a sort of conservative view. But you could then, I suppose, in your overarching narrative, look at sort of the multiplier effects, which do vary, and you can try and come up with some local numbers. There's a number of methodologies out there that you can use, but typically it's somewhere between sort of 1.3 to sort of 2 times the value of someone's earnings gets spent in the economy as a result of someone earning that amount. So I would do that as a sort of an additional bit of analysis once you've completed the initial CBA.
Okay, thank you, Julian. I think that does mark the end now of the question and answers. So thank you to those who've participated, and hopefully you've found it useful. We're now reaching the sort of just the latter ends of the presentation. So if you want to continue, Julian, I think we're going to put a poll up now.
Is it this one here, Jim?
Yeah, so I'll just launch this poll. And it's what do you feel will be the key barrier to you completing your CBA? Okay, I think everyone's voted, so I'll just close and share. So looking at that, it's a fairly equal spread between understanding, our cohort, estimating costs, and forecasting our impact. I don't know if you've got any comments on that, Julian.
As I said, they are all important. I think that's sort of very typical. The impact is generally harder than the costs, and trying to come up with some relatively robust assumptions on what the change in outcomes will be as a result of delivering a project is generally the most challenging. I think the key thing to sort of say is that CBA is an iterative process at this sort of stage. In most projects, you won't have all the answers, so you just have to make the best assumptions you can, but then trying to put in place as you deliver projects some way of collecting better evidence, so you can then repeat the exercise and sort of update your analysis during the process, and then by the end of your project, hopefully you'll have a stronger evidence base of what's actually been achieved by your project.
Okay, thank you. I think the only thing I need to do now to finish off is just to very briefly talk you through our plans between now and the end of March for how we can continue to support you with your CBA going forward. As you know, we've now categorised you into different themes. We are planning a further intervention on CBA in January and again in February. What we haven't quite decided, particularly for the one in January, is how best to do that. We have about 3 options. One is we run another seminar similar to today. The next is that we run a workshop in a location that you have to travel to for a half a day or a day, which obviously has benefit. Or the third one is that we offer the opportunity for one-to-one feedback and assessment from colleagues at New Economy and potentially pro bono. What I am aware of at this stage is that the support that we've offered since the start of the Our Place programme has generally been workshop based, and it's been generic, talking about CBA and the New Economy model. What we haven't done so much of yet, because the timing wasn't right, is actually give you any sort of one-to-one feedback or guidance on your CBA. We're now reaching the stage of the programme where you should be sort of developing your CBA model, and so potentially in January it may be that we sort of facilitate the opportunity for colleagues at New Economy and pro bono to look more rigorously at where you are with your CBA and offer you advice and support on how best you can focus your efforts in the final couple of months before you deliver your operational plan. I'm discussing the options with colleagues from New Economy tomorrow afternoon, and I hope to make it. Well, I will make a decision when we get back after the New Year break. So the first week in January, so week beginning the 5th, I will be getting in touch with you to give you a schedule of support going forward. It would be useful to get feedback from you as to what you feel would be most beneficial. Would it be that one-to-one time and feedback with New Economy and pro bono, or would you want the opportunity to meet face to face and meet other areas going through the same process as you, based around employability sort of CBA? So it would be useful to get your feedback. You've got my email address, and also you can contact the Our Place at locality.org.uk, or email me direct would be more useful, at jim.asprey@locality.org.uk, and just give me a feel for what you would find most useful, and then that will enable me to have a more informed discussion with colleagues and come up with a proposal and a schedule that hopefully will meet everybody's needs in the new year. So in essence, it's watch this space, but there will be at least 2 more interventions, one in January and another in February. Okay, but any comments, email me and I'll pick them up. Okay then, well, we've come to the end of the session, so I'd just like to thank you all for your time. dialing in late on a Thursday afternoon. Wednesday afternoon. It's much appreciated. Hopefully you found it useful. I say contact me if there's anything you need to discuss offline, and we'll look forward to engaging with you again in the new year around CBA. And if I don't speak to you between now and next week, then have a really good Christmas and deserved break. And we'll look forward to picking up everything in place first week in January. So all I'd like to do now is just thank you, Julian, for your input today.
Thanks, and thanks everyone for your input and your questions. Hopefully you found it useful. And have a great Christmas.
Okay, so I'll just sign off now and end the presentation for everybody. So thank you and goodbye.